So I've done lots of videos about who I treat for non-surgical rhinoplasty. And I think what I want to talk about now is who do I not treat? I don't treat everyone that walks through the door. And every week there's one or two people that I refer for surgery. And I know who the best surgeons are in Los Angeles, and so I know that they're going to be in good hands. So who do I refer? Well, number one is the patient with a larger nose who needs physical reduction. And it's just not going to be enough to make their nose straight and make it appear smaller. They actually need to have their bump reduced, to just really make their nose smaller, and surgery is the only way of doing that. Number two is the patient whose nose is very twisted, and I know that if I try to fill it in and try to make it straight from the front, the nose is going to be too wide, and so there also they need surgical intervention. Number three is the patient whose tip just droops down too much, and I can't lift it up enough to make it straight with fillers. And that's just been a judgment that I've developed over the years as I understand more and more the limitations of fillers. And so those kinds of patients I'll refer on to surgery. Number four is the patient comes in with a rounded bulbous tip who want a more elegant, refined, and structured tip. And I can't reduce it with fillers. They have to go to surgery for reduction. If it's a little bit rounded and I think that by lifting it, I can get a little bit more structure out of it, and that'll be enough to overcome the appearance of roundness. I'll go ahead and do that with fillers, and over time I've figured out what those limitations are. But if they're too rounded, it's just not a good idea.
Do cosmetic filler injections with hyaluronic acid really cause cancer? Of course they don't. But these articles get published, and then patients come into my clinic, and I have to explain to them this is complete baloney, right? So this is a great example of how these kinds of rumors and extreme stories propagate all over the internet. I'm talking about this now because I just went to Vegas Cosmetic Surgery Conference, and this came up as one of the conversations on stage in terms of what do we do about all these myths that are all over the place on social media. This started when a plastic surgeon from New York presented data that under eye filler can obstruct a little bit of the lymphatic flow in that area after injection. Now, this is not a new observation. We know this, and we know it causes no clinical impact. And as a matter of fact, if there's a little bit of swelling afterwards, you can always put a little bit of enzyme in there and dissolve the filler, and everything goes away and it's all fine. Now, the issue is that then he speculated that this little bit of blockage will cause health problems. Is there any evidence of that? None. And so this journalist then went on to say, oh, well, if it causes health problems, it must cause cancer because lymph nodes have something to do with cancer. Ridiculous. Anyways, I don't see this paper in PubMed. I don't think it ever got published because the evidence is weak. But, however, of course, the rumor gets started and goes on and on. And so we have to talk about it. Thanks. There was an article that was just posted in Allure that I thought was really quite good. It talked about how some injectables can make a future facelift more difficult, technically more complicated, and more risk for complications as well as poor results. She talked to a bunch of plastic surgeons who agreed that using a lot of biostimulants like dilute radius or Sculptra, or using threads, or using deep energy devices like Ulthera or like some of the RF energy devices could cause scarring. Because what we're talking about when we talk about stimulating collagen is that we're causing controlled scarring. Now, for most patients, that's quite effective in doing what we wanted to do, but for some, they scar more than others, and sometimes those patients can present with issues. Now, I've spoken to a bunch of plastic surgeons as well, and they say that most of the patients they operate on have had something like biostimulatory or energy devices, and it's no problem to do the operation, but occasionally you can get a problem. But in my conversation, what I consistently hear is that what complicates their facelifts more often than anything else is poorly done previous procedures like starter facelifts or mini lifts and things like that people get when they're not really yet ready for facelift, and they're not good candidates, but they get them on the cheap because they think that if they get it early, they can have better results later on. So what to do? Read the caption. We are here with Rhonda. Rhonda, how long have we known each other for?
20 years.
20 years, man. It's a long time. She's actually, I look like hell. With over 20 years, she looks great. She looks the same as it was 20 years ago. What I want to do is just bring her chin down a little bit. Her projection is okay, but I'd like to round out her chin a little bit and then bring it down a little bit. So basically that her lower third of her face is in the proportion that we want, which is 1/3 here, 2/3 here. Okay? So I'm going to use Volux, which is frankly my favorite filler for the chin, to advance the chin area. It's robust enough to bring tissue forward or down or whatever direction I want, but also reversible and with a nice smooth result as long as you have a lot of tissue coverage over where you place the filler. So here we go.